Did you ever wonder that how brain parenchyma is protected from all the external injuries? This is because that brain parenchyma is surrounded by many protective layers around it. Now let's go through these layers. The first layer is called pia mater, which is densely adhered to the brain parenchyma and it leaves no space beneath it. Second layer, it is arachnoid membrane. Below it there is subarachnoid space. Dura mater is present above arachnoid membrane, which is the first layer. Unlike pia mater, it is attached to skull bone at particular points and leaves a space between skull bone and dura mater known as epidural space, and it leaves a space known as subdural space below it. Let's summarize all these layers and spaces. From external to internal, there is skull bone, dura mater, subarachnoid membrane, pia mater, and brain parenchyma, respectively. Space between skull bone and dura mater is known as epidural space. Space between dura mater and arachnoid membrane is known as subdural space. And space between arachnoid membrane and pia mater is known as subarachnoid space. Hey, wait, not this. What's that exactly I want to discuss with you? Hi friends, this is Dr. Pradeep from Scalpel Skills, doing my residency in BRD Medical College, Gorakhpur. Coming to today's topic of concern, SDH and EDH. Let's get on with it. SDH is subdural hematoma and EDH is extradural hematoma. And what's the source of bleeding in these areas? There are bridging veins in the case of subdural hematoma. Let's see what are bridging veins. Bridging veins are small veins that bridges blood flow from superficial veins of brain parenchyma to dural venous sinuses, as illustrated here. And this is superficial view of the same. Coming to EDH, it is mainly caused by middle meningeal artery. Veins contribute bleeding in the case of SDH, whereas arterial bleeding is seen in EDH. Hyperintensity with concavo-convex or plano-convex at the periphery in CT scanning in SDH. And it will show biconvex or lens-shaped hyperintensity in the periphery in CT scanning in EDH. Here you can see CT films of SDH and EDH showing concavo-convex in SDH and biconvex, that is lens-shaped, in EDH. Lucid interval, it is period of consciousness between two periods of unconsciousness. It is mainly seen in EDH. Coming to age of distribution, SDH is mainly seen in old people, whereas EDH is seen in young individuals. No significant history of trauma is seen in SDH, whereas in EDH patient presents with significant trauma such as road traffic accident and fall from height. Coming to treatment, it is mainly focused upon decreasing intracranial pressure. Measures such as giving rest to the patient, head end elevation, pain relief. Mannitol can be used in the case of SDH and it is contraindicated in the case of EDH. And the ultimate resort is decompressive craniectomy if the patient presented with midline shift and not improving with conservative management. Thank you for watching and we'll meet you in the next video. Until then, bye bye.